Hello everyone, my name is Dr. Parsa from PKL Physical Therapy and Wellness with offices in Amityville and Bethpage, Long Island. I want to ask people why everyone jumps into the operating room without seeing a physical therapist first. Now I understand if you fall down at some kind of traumatic event going on and your elbow gets hyperextended and dislocated, or your knee gets bent backwards and you break something, or you land on the shoulder, all those things I get where you would need surgery for that to fix a structural problem. But my question is to the people that come in that make up 80% of my evaluations, and they say, hey, you know what, my shoulder's been bothering me, I don't know what's causing it, or my knee's been tweaked and it's bothering me when I go up and down the stairs, and they have an x-ray or they have an MRI, and the MRI usually shows some kind of micro tear in the rotator cuff or a meniscus tear in the knee, but nothing else physically matches up with a meniscus tear. Meaning, if you never told the person that they had a meniscus tear, nothing that they do functionally would even remotely show any orthopedist or myself that there's a meniscus tear. But the fact that there's a meniscus tear that comes up on an MRI, all of a sudden now everybody thinks I have to go fix this meniscus tear because this meniscus tear must be causing my pain. And what I've found over 10 years of practice is that's rarely the case. A lot of people come in, I have an MRI, and the MRI says that I have a torn meniscus. And I say nothing physically about you shows that you have a torn meniscus. So if you want to go do surgery to just fix something that's on an MRI, go ahead. But that's not what's causing your pain. Usually what's causing their pain is a muscular problem. I'm not saying I've never had any patients that walk in here and they haven't had a meniscus tear and that's what was causing their pain. I've had it. But it's minuscule in the amount of percentage of people that have come through this door that it's been, yes, an MRI shows they have a meniscus tear, but the pain has nothing to do with that meniscus tear. Or an MRI shows they have a herniated disc in L1, L2, and there's no pain down the legs, there's no symptoms into the groin or in the thighs, and it has nothing to do with what's causing their pain. And usually, again, in the lower back, it's caused by something going on in muscle. So just because you have something that comes up on an MRI or an X-ray does not mean that it needs to be corrected right away, unless it's life-threatening. Listen to your doctor, you make your own decision. I'm not going to tell you never have surgery, okay? That's not what I'm here for. I'm just saying if you have the option and you ask your doctor, do I have the option to try something lesser invasive, or do I need to have this surgery right now today? If they say, oh no, you could try something less invasive, then try physical therapy. All right? I can get you out in a lot less sessions before you have surgery compared to after you get surgery. All right? I'm just using numbers here. I may be able to get somebody pain-free and without any kind of physical limitations in 8 to 10 sessions if they never had surgery. If they have surgery, it's going to take a hell of a lot more than 10 sessions. So just remember that, all right? It's not that I'm trying to have you come to physical therapy and not have surgery. I'm actually trying to have you save on physical therapy visits by not having surgery. And that's the best way to do it. If you have the time and you have the option to do physical therapy, which I don't see why you wouldn't, come to physical therapy. We can find out the true source of your pain, which again is usually muscular, and we can help stay out of that operating room. You'll still have a meniscus tear. You'll still have a herniated disc, but it won't be impeding your function and it won't bother you at all because nobody's perfect. You take an MRI of anybody, you're going to find something wrong. That doesn't mean we have to go under the knife and get everything fixed. All right? There are many risk factors to surgery. I think we could all agree on that. So if you have any questions and you want to talk about any kind of discomfort that you're having, give us a call. Look us up, pklpt.com, and we'll answer any questions that you may have. Thank you.